As you prepare for your joint replacement surgery, Rehab Services will play an important role in your procedure and recovery. During your recovery, following surgery, you will have both physical and occupational therapy. Therapists and/or therapist assistants will work with you on learning how to move safely and care for your new joint replacement during your hospital stay. The rehab team will also educate you on any recommended adaptive equipment needed for your care at the hospital and at home. For optimal results after your joint replacement, early activity and exercise is critical. Therefore, the role of therapy is to get you up and get you moving. Occupational therapy will focus on activities of daily living such as dressing and bathing, along with recommending any adaptive equipment that you may benefit from. Physical therapy will focus on bed mobility, transfers, ambulation, stairs, range of motion, and strengthening. We'd like to say that this joint replacement becomes your new full-time job. If you focus on doing your exercises, going for walks, and participate in your therapy sessions, you will improve your outcome. Please remember, you are personally accountable for 50% of your final outcome. It is your responsibility to help achieve your goals and expectations. Your recovery is all about what you do to keep moving. Your joint will be better than it was before surgery, and it will need your personal touch to fully recover. Most likely you will need a walker after surgery. Therapy recommends a walker that has straight wheels. There are walkers that have swivel wheels. However, these wheels move more freely and may not provide you enough support. There are also walkers without any wheels. However, these walkers you would have to pick up with each step. If you already have a walker or are able to borrow a walker from someone, you can bring it to the hospital for the therapy staff to make any adjustments. Therapy will adjust the height of the walker to the appropriate height for you and will look it over to make sure it is working properly. There is a possibility you may progress to crutches prior to discharge if your therapist feels you can use these safely. Your therapist will recommend what they feel is the best assistive device for you. You may see a few different pieces of medical equipment like a gait belt. These sturdy belts are used by staff members when you get up and move. Another safety device, these belts are used to help assist you in regaining your balance if you were to lose it or begin to fall. They also help you stand or transfer if you are too weak or groggy after surgery. Your bed will likely have a trapeze on it when you return from surgery. By pulling on it with your arms, you can reposition yourself in bed without having to use your legs. An abdominal binder is a wide compression belt that will go around your hips, similar to an ACE wrap. It puts pressure on your surgical site to help with stability and swelling. You will wear this while in bed, but it is to be removed when sitting or walking. ICD stands for Intermittent Compression Device. These will be placed on your lower legs to help prevent blood clots. They should be worn 20 out of the 24 hours a day. They are portable and can be used when walking. They will be used for 14 days after surgery. Following surgery, you will recover in the hospital and work closely with your entire team to determine the appropriate day for discharge. Pain after surgery is a normal body response. It is our goal to minimize and control your pain as much as possible. However, your pain needs to be at a level that allows you to do your exercises and therapy. This is called functional pain. Functional pain is described as pain that is not gone, but controlled enough that allows you to function during exercise, ambulation, and your recovery. The goal is to minimize and control your pain. Pain goal is 4 to 5 on a scale of 1 to 10. First, physical therapy will work on a few exercises that will be discussed later in more detail. Therapy will work on bed mobility to get you sitting up at the edge of the bed. While sitting, therapy will assess for feelings of dizziness, nausea, and may check your blood pressure. As long as you tolerated sitting at the edge of the bed, therapy then will have you try to stand up for the first time using a walker for support. In order to stand, first therapy will have you scoot to the edge of the bed so your feet are flat on the floor. Then prior to standing, you will place your surgical leg out in front of you, Once sitting with your surgical leg out in front, then we will have you attempt to stand. Therapy will have you push up from the bed using your arms to assist. You never want to start with your hands on the walker trying to pull yourself up because the walker could tip backwards. This could cause you to lose your balance during mid-transfer, causing you to fall. This could lead to an injury. Once standing, you could move your hands onto the walker and slide your surgical leg to the other leg to get yourself in a good stance. At this time, if needed, therapy will adjust your walker to the appropriate height. Fitting the walker to the height, therapy will have you stand with good posture. Therapy will adjust the height of the walker to be at your wrist level. If your walker is not available for therapy to adjust, they will provide you with education on how to make the correct adjustments prior to your discharge. Once the walker is at the appropriate height, therapy will have you do a couple of weight shifts prior to taking some steps. A weight shift is shifting your weight onto one leg and then back to the other. You may not have 100% feeling back in your surgical leg yet, so therapy would like to assess how you tolerate this before taking some steps. Therapy wants to make sure that your legs will fully support you. As long as you are able to stand safely, then therapy may have you take a couple of small steps to turn. To turn, you will hold onto the walker and take small steps, turning until you are lined up in front of the chair, which is placed beside your bed. To make sure you are lined up in front of the chair, you should feel the chair on the back of your legs. It is important to take small steps and not pivot on your surgical leg. Prior to sitting down, you will place your surgical leg out in front of you again, just like you did when you stood up. You then will reach back for the armrest and slowly lower yourself into the chair. Just like standing, you do not want to sit with your hands on the walker because, again, the walker may tip back and cause you to lose your balance with an uncontrolled descent, placing you at a higher fall risk or injury. Once therapy sees that you can safely transfer to the chair, you will get up for all 3 meals. Therapy recommends that you do not sit up for extended periods of time, as this could cause you to get stiff and increase your swelling. Therapy will take you through a several gait or walking patterns. You will have therapy up to 2 times a day. Therapies will progress you daily in your bed mobility, transfers, ambulation, exercises, and stairs prior to discharge. Detailed information and exercises will be addressed later. Occupational therapy staff during your hospital stay will assist you in independence with activities of daily living. They will also evaluate your ability to perform these tasks and begin instructions on any special techniques and any recommended equipment you may benefit from for completing self-cares, including bathing, dressing, toileting, without risking damage to your new joint. Remember, up with the good, down with the bad. Prior to discharge, therapy will educate you on how to do the stairs. Therapy will have you go up and down the stairs to simulate your steps at home if applicable. After a surgery, you will likely need to take the steps one at a time, which is what some of you may already be doing. We have a golden rule that we tend to follow when going up and down the steps. It is up with the good, down with the bad. This means when you take the first step up, you will lead with your good leg first. This is your non-surgical leg. Going down the steps, you will lead your bad leg first. This is your surgical leg. Remember, one step at a time until your therapist tells you different. After surgery, you will have some hip precautions. Avoid hip hyperextension. This is kicking the leg behind the body. Limit external rotation. This is avoid turning your leg out. Do not plant your feet and twist on your surgical leg when turning. Do not cross your legs at the knees when standing. Sit in a firm chair with a straight back and armrest. Avoid stools, sofa, soft chairs, rocking chairs, and chairs that are too low. Your hips should be higher than your knees when you are sitting. Sit on a cushion if you have to. Keep your feet and knees pointed straight ahead, not turned in or out while sitting, standing, or lying. As mentioned earlier, when getting up from a chair, slide towards the edge of the chair, place your surgical leg out in front of you, and use the arms of the chair for support when transferring from sit to stand. Do not place a pad or pillow behind your knee when lying down. It is important to keep your hips straight when resting. Nursing may have you elevate your surgical leg while you're resting to decrease swelling in your leg. That's okay, because it's also important that you get your swelling down. You will be discharged from the hospital when your healthcare team feels you are medically ready and you have successfully met physical and occupational goals. Goals for independent safe discharge are as follows. Understand all precautions and safety concerns. Understand and be able to do your home exercise program. Get up and down from a chair or toilet safely and independently. Walk on level surfaces using a walker or crutches as needed. Do self-care tasks using adaptive equipment if needed. Walk up and down steps using a banister or assisted device. Learn to not pivot on your operated leg. If you are returning home and have support team in place, your surgeon will recommend you to continue with your home exercise program that was prescribed during your hospital stay. If indicated later, your surgeon may have you attend therapy on an outpatient basis. If there are medical reasons why additional care is needed, the healthcare team will address them as they arise, such as home health services or short-term rehab. To build your strength and to aid in your recovery, start doing all of your rehab exercises starting today. This will allow you to become familiar with them, which will help you during your therapy sessions. Encourage your support person to go through these exercises with you, as they may need your help after surgery. During your therapy sessions, the therapist will provide education and assist you with your exercises to make sure they are performed correctly. Your therapist prior to discharge will provide you with your personalized home exercise program. Ankle pumps. This is good to prevent blood clots, assist with decreased edema, and improve blood circulation. Position. Begin lying on your back with your legs straight. Movement. Slowly pump your ankles by bending and straightening them. Helpful tips. Try to keep the rest of your legs relaxed while you move your ankles. Quad sets. Position. Begin lying on your back on a bed or flat surface with your legs straight. Movement. Tighten the muscles in your thigh of your surgical leg as you straighten your knee. Hold for 5 seconds, then relax and repeat. Helpful tips. Make sure to keep your toes pointed towards the ceiling during this exercise. Try to flatten the back of your knees towards the bed. Glute sets. Position. Begin lying on your back with your legs resting comfortably. Movement. Tighten your buttock muscles, hold 5 seconds, then release and repeat. Helpful tips. Make sure not to arch your low back during the exercise or hold your breath as you tighten your muscles. Keep your knees flat. Short arc quad. Position. Begin lying on your back with a towel roll under your surgical leg with your heel resting on the ground. Movement. Tighten the muscles in your upper leg to straighten your knee. Hold, then return to the start and repeat. Helpful tips. Make sure to keep your back flat against the floor or bed as you move your leg. Heel toe raises. Position. Begin in standing upright position with your hands resting on a counter in front of you. Movement. Rise up onto your toes, hold briefly, then lower back down and lift the balls of your feet off the ground. Repeat. Helpful tips. Make sure to maintain an upright posture and use the counter to balance as needed. Chair push-ups. Position. Begin sitting upright with your hands resting on the armrest of the chair. Movement. Straighten your arms, lifting your body off of the chair. Hold briefly, then lower back down and repeat. Helpful tip: make sure to use a sturdy chair and use your legs to balance as needed. Do not shrug your shoulders during the exercise. Quad sets. Position. Begin lying on your back on a bed or flat surface with your legs straight. Movement. Tighten the muscles in the thigh of your surgical leg as you straighten your knee. Hold for 5 seconds, then relax and repeat. Helpful tips. Make sure to keep your toes pointed towards the ceiling during the exercise. Try to flatten the back of your knees towards the bed. Glute sets. Position. Begin lying on your back with your legs resting comfortably. Movement. Tighten your buttock muscles. Hold for 5 seconds, then release and repeat. Helpful tips. Make sure not to arch your low back during the exercise or hold your breath as you tighten your muscles. Keep your knees flat. Supine ankle pumps. This is good to prevent blood clots, assist with decreasing edema, and improve blood circulation. Position. Begin lying on your back with your legs straight. Movement. Slowly pump your ankles by bending and straightening them. Helpful tips. Try to keep the rest of your legs relaxed while you move your ankles. Shorter quads. Position. Begin lying on your back with a towel roll under your surgical leg with your heel resting on the ground. Movement. Tighten the muscles in your upper leg to straighten your knee. Hold, then return to the start and repeat. Helpful tips. Make sure to keep your back flat against the floor as you move your leg. Passive range of motion, hip abduction and adduction with caregiver. Position. The patient should be lying on their back with both legs straight. The caregiver should have a hand under the patient's heel and the other hand under the patient's knee. Movement. The caregiver should then gently move the patient's leg outward. This motion should not be greater than 35 degrees. Hold briefly, then return to the starting position and repeat. Your therapist in the hospital will demonstrate to you what 35 degrees abduction is. Helpful tips. The patient should stay as relaxed as possible during this exercise. There should be no movement of the pelvis, and the hips should not be rotated or flexed. Passive hip flexion with caregiver. Position. The patient should be lying on their back. The caregiver should be holding the patient's leg below their heel and on the side of their knee. Movement. The caregiver should gently lift the patient's leg, guiding their knee towards the chest. The motion should not be greater than 90 degrees hip flexion. Hold briefly, then return to the starting position and repeat. Your therapist in the hospital will demonstrate to you, instruct on what 90 degrees hip flexion is. Helpful tips. Perform this motion slowly. The patient should stay as relaxed as possible during this exercise. There should not be any rotation at the hip. If you have steps with no railings, therapy encourages you to have at least one railing installed. 2 would be ideal, if possible. Having railings with your stairs will make it easier to enter and exit your home. Remember, up with the good, down with the bad. If your bedroom is upstairs, consider using a main floor room for a bedroom initially. Traffic pattern. Move obstacles such as throw rugs, extension cords, footstools out of your walk. Create a wide, clear path from your bedroom to your bathroom and kitchen so you can easily move about with your walker. Bathroom. Install a raised toilet seat in the bathroom if you're unable to get on and off the toilet easily. Grab bars, tub rails, and a shower chair may be beneficial as well. Install non-slip surfaces in the tub and shower. Find a chair to sit in that has a firm, straight-back chair with armrest. A dining room chair may work if you don't have others. To avoid reaching or bending, keep frequently used items within reach, especially in the kitchen, bathroom, and bedroom. In case you cannot wear pants with pockets when you first return home, consider getting an apron with pockets so you can carry around your phone and/or other items after surgery. If you are using a walker, attach a walker bag to the front of the walker to carry items from place to place. It is a good idea to carry a cell phone or a portable phone with you at all times during surgery. Get help with cleaning and laundry when you first return home. Have a few weeks' worth of clean clothes available to you. Small children and pets can pose a safety hazard to your recovery. Small children may need to be taught how to interact with you in ways that keep you safe. If you have pets, make arrangements to keep your pets in another area of the house when you arrive. Arrange someone to collect your mail or place delivery on hold during your stay at the hospital. Arrange for help with meals and perishable foods. Prior to surgery, freeze pre-made dinners and other meal items. Stock up on non-perishable foods to make it easier to prepare meals after surgery. You can also call your local Aging Disability Resource Center to see if you qualify for Meals on Wheels. Arrange for someone to drive you to your appointments after surgery. Do not drive until your healthcare provider says it's okay. Break up long car rides. Stop, get out, and walk about every 2 hours. You may need to move your seat back and sit on a firm cushion to make it easier to get in and out of your car. Make sure to wear shoes with backs on that can easily be slipped on and off. Do not wear clogs or sandals. Use your walker until your doctor or therapist tells you it's okay to stop using it. Your therapist usually starts you with a front-wheeled walker during your hospital stay. When you are strong enough, your therapist or doctor will transition you to a wheeled walker, crutches, or cane. Once again, please remember you are personally accountable for at least 50% of your final outcome. It is your responsibility to help achieve your goals and expectations. Your recovery is about what you do to keep moving. Your joint will be better than it was before your surgery, and it will need your personal touch to fully recover. In summary, we've talked about a lot of things. We've talked about making sure your pain is under control and what to expect during your hospital stay with therapy. We talked about making sure you have the right walker and getting your home set up prior to your surgery. We talked about your hip precautions. And we talked about the importance of exercises and how you need to start them today to become familiar with them, increase your strength and range of motion prior to your surgery. Therapy would like to say that this joint replacement becomes your new full-time job for the next few months. If you focus on doing your exercises and going for walks, this will improve your outcome. And you're getting this new joint replacement because you want a good outcome, right? So make sure you do your homework. Mile Bluff Medical Center Rehab Department is looking forward to helping you meet your goals. Good luck to you all.